Ladies and gentlemen, it's my delight to introduce to you Alp Life Sciences. And I'm even more excited to bring you the information on how to reduce the risk of the fastest growing epidemic in the world. The information we're going to cover today can and should affect millions of lives. And just how are we going to do that? Well, through applied lipid polymorphism. It's a fancy way of saying we're going to use good fat to remodel bad fat. And seeing as how every single one of your cells is made up of a fatty membrane, it will most definitely remodel your health. The question should be posed, what is the fastest growing epidemic in the world? And the mounting scientific evidence is pointing to chronic inflammatory diseases, with one common denominator and driving factor behind all of them: silent inflammation. Let me show you what I'm talking about.
Inflammation is more common than you would think. It can cause stroke, heart attack, and even cancer. It starts as a slow burn inside of your body, and it acts like an emergency unit responding to infection and injury. The tender, throbbing hotspots that may feel uncomfortable are actually part of your body's natural response. It means your immune system is sending the internal signal to launch white blood cells and protein to destroy infection and heal injuries. But if the inflammation lingers after the job is done, or your immune system becomes confused and misfires by accident, what was once your best friend can quickly become your worst enemy. When inflammation becomes chronic, your body's natural defense system takes a turn for the worse by starting a sneak attack on your joints, tissue, and blood vessels, wreaking havoc on all of those areas that were once pain-free. That's when the slow-burning throb becomes a 5-alarm fire. For years, researchers have found that chronic inflammation can be linked to rheumatoid arthritis, multiple sclerosis, and asthma. But the newest and most modern research shows a lot more. Chronic inflammation could very well be at the heart of the life-threatening diseases that we all fear the most: cancer, heart attack, diabetes, and even Alzheimer's. Is chronic inflammation eating away at your body?
So we are obviously going to talk about inflammation, but what are the topics that we're going to cover in this presentation that should impact your thoughts about medicine? Well, first, the discovery of eicosanoids and how they help regulate these chronic inflammatory diseases. Second, the science behind Alp-3 and the 4 critical questions we think everybody should ask. And third, the balance that gives health and life and how you can personally measure it. Starting from the beginning, this gentleman here is Hippocrates, known as the father of modern medicine. Now, he left historical records about pain relief treatments to include the use of powder made from the bark and the leaves of the willow tree to help heal headaches, pains, and fevers. Now, can anybody guess what that powder was? Aspirin. It's one of the most widely used medications in the world, with an estimated 88+ million pounds of it being consumed each year. Now, that's a lot of little pills and powder. To put things in perspective, that's the equivalent to 658 M1A tanks weighing in at 134,000 pounds each. Now, why am I talking about aspirin if what we're going to address is chronic inflammation and talk about Alp-3? Well, you're about to find out. Aspirin brought these 3 men together, and now you get to benefit from their discovery, which is far bigger than aspirin. They won the Nobel Prize in 1982. Now, this was for their discoveries concerning hormones called eicosanoids that regulate inflammation. Now, this is what was mapped. So everything below this arachidonic acid here is considered a eicosanoid, or a hormone that helps regulate inflammation. And the first one was found in the prostate gland, thus named prostaglandin. It was in 1935, and the thinking at the time was that all hormones were produced from organs or glands. But as you'll see today, that's not true. Now, aspirin was finally understood in 1971 of how it was blocking pain for the first time. Another drug worth mentioning that stops this entire cascade dead in its tracks are corticosteroids, probably the most powerful eicosanoid inhibitor. Now, there are lots of chronic diseases that are being driven by these metabolites of this arachidonic acid. My grandfather died of prostate cancer, and you cannot have that without having the prostaglandin pathway. Many of you are suffering from cardiovascular diseases. And you can't have a heart attack without thromboxane pathway. For those that have the ailment of arthritis, pain and stiffness comes from your leukotrienes. So obviously there are lots of drugs that have come and gone off and on the market that stop, block, or manipulate 3, 5, or 12 steps down this pyramid and ladder, which is actually much bigger than what's shown here. But nobody is talking about the headwaters, arachidonic acid. This controls your pro and your anti-inflammatory responses. And if you can control the metabolites that are being produced from it, then you can effectively control your pro and your anti-inflammatory responses, which is your #1 line of defense from everything from a rolled ankle to chronic inflammatory diseases, as you'll soon see. This is Dr. Barry Sears. He's a PhD biochemist who has been an instructor at Boston University Medical School as well as MIT. He holds 13 U.S. patents in areas of hormonal regulation for treatment of cardiovascular diseases. Now, he's been looking at chronic inflammatory diseases for 30 years or so he might know a little bit on the topic of eicosanoids. And here's what he says. Most chronic diseases are a consequence of an imbalance of good and bad eicosanoids. His definition of bad: too much arachidonic acid drives chronic inflammatory diseases all day long. So why are eicosanoids so unknown if they're so important? Well, for thousands of years we've been playing hide-and-go-seek trying to find them. And it's only been in the last 30 to 50 years that we begin to discover them, and we still are discovering new ones every year. So let me show you why they're so hard to detect. First, they are made to act and self-destruct within seconds, making them very difficult to study. Second, they don't circulate in the bloodstream, making them extremely difficult to sample. Third, new eicosanoids are discovered every year, followed by a growing knowledge of how they work. And finally, they vanish at very low concentrations, making them almost impossible to detect. Yet despite these barriers, more than 87,000 articles on eicosanoids have been published in peer-reviewed journals. Now, eicosanoids are synthesized by all of your cells, and the average human body is made up of around 100 trillion cells, and all of them are capable of making these hormones on demand. So how do you regulate 100 trillion cells, and how do they produce these eicosanoids? Let's take a look. Your omega-6s and your omega-3s are found within every cell membrane. Now, just where do you get these from? Well, the LA over here on the left comes from soybean, safflower, sunflower, corn, canola, cottonseed oils that are typically found in most of your highly processed carbohydrates, like even your breads, Cheetos, Tostitos, you name it, as well as the fast food restaurants use these to cook, and many people use these to cook in their house, so you're getting plenty of this, I promise. ALA on the other form you could use some more of as a standard Western diet. It comes in your dark leafy greens like kale and spinach, your seeds and nuts like flax, chia, or walnuts, and your body is very good at converting these fats into what it needs. It can either elongate or desaturate, meaning shorten or lengthen them, and as it does, you come up with more fatty acids on its way towards producing eicosanoids. Now, GLA over here is actually inhibited by two things: trans fatty acids and DHA. Now, trans fatty acids have a really nasty side effects, and DHA makes up about 20% of your brain. Both of these will inhibit the omega-6s from turning into pro-inflammatory eicosanoids through the delta-6 desaturase. So DHA is very good for you, and you need it. The next step down here, dihoma-gamma-linolenic acid, or DGLA, starts to produce your eicosanoids. Now, there is a determining factor found within your diet, and it's called the delta-5 desaturase. This enzyme will be activated by insulin, meaning if you are eating a highly processed carbohydrate diet, i.e. grains, flours, sugars, then you will have plenty of delta-5 activated to turn DGLA into arachidonic acid. And that is an extremely inflammatory response, as well as it will help you pack on fat. So that is a huge issue, whereas EPA, the good cold water marine life type fat, will block this transformation process or slow it down, and that is why it's anti-inflammatory. So these three are the building blocks for all eicosanoids, and they generally flow through two more eicosanoids called the COX and the LOX, and we talked about aspirin inhibiting cyclooxygenase. and they produce either pro or anti-inflammatory eicosanoids from the 6's and 3's, and that's the story of how they control and regulate inflammation. Now, I can't overemphasize this delta 5 desaturase. This is the crux of the obesity epidemic, as well as the main contributing and driving factor to chronic inflammatory diseases. Now, too many omega-6s with highly processed carbohydrate diet will produce excess fat and inflammation all day long. Now, this increases your risk for chronic inflammatory diseases. So let's talk about the chronic diseases that are being driven by this omega-6 with highly processed carbohydrates. Well, the AA that's produced contributes to the number one killer, cardiovascular disease, the scariest one in my opinion, the neurological conditions, chronic inflammatory disorders, diabetic complications, metabolic disorders, chronic pain disorders, cancers, and even mental health disorders. So that's a lot of disorders, and it probably makes up about 50% of the average patient visiting a family practice or internal medicine doctor. So let's forget about all these conditions, which is just the tip of the iceberg, and keep it simple. Too much AA drives these. Now, if you were to look at just the number one killer, okay, cardiovascular disease, here's what you would find. Heart disease is the number one cause of death for both men and women inside the United States, claiming over 1 million lives annually. Let me introduce you to the biggest stadium in the US, the third biggest in the world. It holds a little over 100,000 people, and it's the Michigan Stadium. This stadium, times 10, die every year from cardiovascular diseases. Now, 250,000 Americans are going to have a heart attack. 684 will die a day. And to put things in perspective, the New England Journal of Medicine and many other articles highlight this point. A 90% reduction in sudden cardiac death, depending on your omega-3 index. Basically, this goes on to say that 2 grams of fish oil a day can increase your chance of surviving a heart attack by 90%, not to mention reducing the risk of it. So 615 people a day could survive a heart attack just by balancing their omegas. Pretty valid and big point. An estimated 80 million Americans have one or more type of heart disease. That means when you look at the United States as a whole, a little less than 25% have it. Now remember, we're only talking about one area, cardiovascular disease. If you look at chronic inflammatory diseases as a whole, the numbers are astonishing. Looking at the bigger picture here of chronic inflammatory diseases, almost half of the American population suffers from a chronic illness, which is the leading cause of death and disability inside the US. To be more specific, 7 out of 10 deaths among Americans will come from these chronic inflammatory diseases, with heart disease, cancer, and stroke accounting for the majority of them. That means that 7 out of 10 of you watching this are likely to die from a chronic inflammatory disease, and what I'm talking about could save your life. Now, health reform was quite the doozy, but here's something that affects all of our pockets. Patients with more than one chronic condition account for 95% of Medicare spending. That's billions, yay trillions of dollars. And what we're talking about today could drastically reduce those. A good question to ask right about now would be, what ratio of omega-3 to 6 intake should you have in your diet? Well, a healthy ratio would be around a 1 to 3 or a 1 to 4 of 3's to 6's. The average Western diet is around a 1 to 22. I've seen it as low as 1 to 12, but nevertheless, you pair either one of those with a highly processed carbohydrate diet, and you're going to have excess fat packed on all day long, the obesity epidemic, and you're going to drive inflammation, chronic inflammatory disease epidemic. Obviously, inflammation is the driving factor to these chronic diseases. So how do we regulate them? Diet and fish oil. Alpine 3 in particular will reduce this production of bad eicosanoids. This is because it goes upstream to modify eicosanoid production by reducing arachidonic acid levels. So you can effectively say, if you reduce AA, you reduce inflammation, which means you reduce the risk of dozens of chronic inflammatory diseases. So now that we've gone through eicosanoid production and how you can personally reduce your risk of inflammation, let's talk about some questions here regarding ALP. The 4 critical questions every doc and patient should ask, especially when looking to catch the best benefits of omega-3 oils. First, is there a difference between ethyl esters and triglycerides? Second, are omega-3s destroyed by stomach acid? Third, what kind of fat are you getting and how much? And fourth, does buying low-quality omega-3s supplements save you money? First, ethyl esters versus triglycerides. Do these look the same to you? Yeah, they're about as different as the fish oil you could be swallowing. Most people don't know it, but the average fish oil is soaked in alcohol to get the PCBs, mercury, and dioxins out, and then they leave it in that form. Whereas if you were to look at a wild salmon salad over here on the right, you would find that the form is very different. It comes in the triglyceride form, and the omega-3s are very high in a wild salmon, not to be confused with a farm-raised salmon, which the omega-3s will actually be much lower if it's fed grains. And that's true for all meat. And take a guess what form your body uses and transfers fat in all day long. The answer is triglycerides. Over 98% of fat ingested are in this form, so it makes the most sense to take your fish oil in this form, doesn't it? That's why Alpine 3 turned it back into the natural triglyceride form. You can't say the same for the average RX and the majority of over-the-counter. Case studies that compare ethyl esters versus triglycerides. This is one that compares 3. They threw free fatty acids in there as well. But what I want to know is the bioavailability of the EPA and DHA from reesterified triglyceride, which is what an Alpine 3 is, which was superior at 124%, and the ethyl esters inferior at 73%. Now that's about a 50% boost. Another point is the method of absorption. Ethyl esters have to go up the portal vein to the liver because they're an alcohol metabolite to find that glycerol backbone, unless you're eating your fish oil with fat, which everybody should be doing anyways. Helps boost the absorption. I've seen studies anywhere from 40 to 60%. Now, if you already have that fat, like Alpine 3, and it's enteric coated, it didn't get pulled apart, it makes it straight into the intestines where it will jump into your lymphatic system, boosting your immune system and your heart health quicker and more efficiently. Now, I also saw a recent study in 2013 that talked about ethyl esters contributing to cirrhosis of the liver. If you don't know, fatty liver disease is about number 12 in the world as the top killer, and millions have it, especially if you're eating a Western American type diet. And cirrhosis is a dying, literally, of the liver, and ethyl esters are taxing the liver as any alcohol would. So one more thing to take note of: what form are you buying your omega-3s in? Secondly, are omega-3s destroyed by stomach acid? Well, it's a little less potent than battery acid, but you can imagine what it would do to a little gel capsule, or to any food for that matter. Matter of fact, your stomach can dissolve steel. It breaks everything down pretty much to its base molecular formula. Then it gets reconstituted in your intestines. So the right question should be, is there a difference between enteric coating versus non-enteric? Well, some studies show a 67% or more absorption with an enteric coating. Not to mention, you're not going to have a burpy, fishy after flavor. And that is due to a double enteric coating on ALP. Now, ALP is one of very few that I know has a coating, and to my knowledge, the only triglyceride with 2 enteric coatings. So be looking for that, because those that are gluten sensitive, celiacs, Crohn's, even overweight, any kind of leaky gut, this enteric coating is going to help absorption massively with your issues. Now, you should be buying a natural triglyceride form, which is another massive boost. And it's good to look for a pharmaceutical grade, meaning 60% or more of the omega-3s are EPA and DHA. And that standard has been used loosely throughout the fish oil industry, but IFOS, the third-party testing company that we send ours off to would say 60% or more is a pharmaceutical grade. They test hundreds of oils and they ranked ours 5-star, meaning the highest purity available. So third point is, what kind of fat are you getting and how much? This is an 1812 oil. This is the industry standard. It has been the bread and butter since fish oil began 30, 40, 50 years ago. It's still the majority of oils sold are in this low dose, meaning the EPA and the DHA down here make up 30%. 18% EPA, 12% DHA. Sometimes it's flipped. Consumers need to pay attention to this level because you are obviously looking for the health benefits of the EPA and the DHA. And if it is a low-grade 1812 oil, you would have to take lots of these to get any health benefit. So it may say 1,000 milligrams of omega-3s or concentrated fish oil in this case, but you're actually only getting 30% of the good stuff. Now, pharmaceutical grade will be 60% EPA and DHA and higher, so that means you would have to take 4 of these to equal 1 of those. And that's not including the triglyceride form and the enteric coating boost. So this product and most others not only contain saturated fat, but they also require as many as 24 soft gels for the same omega-3 absorption as only 2 alpine 3. So this is considering the triglyceride versus the S-ester and the coating type. Now when we look at swallowing 24 of these, you're going to be amazed. The saturated fat here, even though it's only 0.5 grams, if you were trying to get the same absorption, you're going to end up with 10,950 grams of excess fat a year. Now how many people can afford 168 days worth of extra FDA recommended daily fat intake? Not many. Anybody who is a health junkie has sat there comparing labels. Well, we made it extremely easy to compare fish oils on our website. Using this calculator at alplifesciences.com, you can plug in your information into these boxes, and I want to highlight this one area which you can actually change the percentages we give to the triglyceride boost and the enteric coating boost down below. So feel free to do that, and then you can check whether or not your product even has them. So before I show you the results of that, let me make one more point. The fourth point here is, are you saving money by buying low quality omega-3 oils? Everybody loves to save money, and the cheaper oils are like a quarter of the price of alpine 3. So very valid question, and this is just one more thing that makes alpine 3 superior. If you're looking to get the penetration and absorption, then obviously you're going to want to go with Alp, and whether you're recommended it or you buy it yourself, you're going to be keeping money in your pocket. So let me show you the results of the. Here you have it, and the fat results for swallowing 24 of these to try to get the same absorption is about 30 grams, RX 8 grams, alpine 3 2 grams of fat per day. When you look at the cost down here at the bottom, $60 a month for the average Amazon buyer with a discount code. If you go to the average Walmart, Walgreens type stores, you're going to pay $143, $480 for the average RX, and $35.95 for alpine 3. Now, if that's not a no-brainer, I don't know what it is. But when it comes to fat and when it comes to price, alpine 3's got these beat. Let me introduce you to Dr. Robert Barker. He's the chairman of Alp Life Sciences, and I asked him to comment on silent inflammation and how that is viewed in his opinion. And here's what he said. He said, most of the time you can't see silent inflammation or feel it. And the AA-EPA test is an excellent way to measure your current risk and problems, and at the same time, it motivates individuals to reduce their chance of chronic inflammatory diseases. Now, he's been practicing 30 years, and of all the things he could use to measure risk, he's saying the hundreds of blood tests that can be done, AA-EPA ratio is the one that is most valuable. Now, you remember Dr. Barry Sears. Here's what he says about the ratio. The best markers of wellness is the AA-EPA ratio in the blood. This is the gold standard for determining the extent of silent inflammation in a patient. So there you have it. another vet of 30 years telling you that the AA-EPA ratio is an excellent resource. The question was posed, what is the balance that gives health and life, and how can you do it individually? The AA-EPA ratio gives a balance of health and life. If you keep this in check, your chances of contributing or contracting a chronic inflammatory diseases is very rare, and there is lots of science behind that. So even if your predisposition is to have certain cancer in your family or heart disease, if you keep this baby in check, you're not going to have to worry about those nearly as much. So if you could measure your risk levels for dozens of chronic diseases, would it be of value to you? And if you could track the progress of those risk levels, would that be of value to you? If you answered yes, Nutrisource Diagnostics is an excellent resource for you guys. It gives you the AA-EPA ratio, they call it the omega score, and along with dozens of other fats, so you get to look at the last several months of what you've been eating in the fat world and just how you can better regulate those. So you can actually get this on Alp Life Sciences website and buy it there and do it yourself. That is extremely valuable. You don't need to go to the doctor's office. This is one of the better companies for the cash pay buyer as far as the price, bang for your buck, and you can finger prick yourself and send it off to a lab and have the results that measure your risk levels. Then you can do it again in 3 to 6 months and track your progress. So it's extremely applicable and valuable to over half of the US who are suffering right now from a chronic illness. So spread the good news, spread the love, and use Nutrisource Diagnostics. So if it's not clear yet on how to manipulate that AA-EPA ratio, let me introduce you to Alpi 3. It is an excellent fish oil that is a natural triglyceride, double enteric coated, pharmaceutical grade, and third-party tested with very high EPA and DHA levels. So in closing, I propose a life-changing benefit that you can personally test and track for progress. 2 capsules a day of Alpi 3 will reduce your risk of chronic inflammatory diseases by remodeling your health with Alp, applied lipid polymorphism, using good fat to remodel bad fat. Now you can buy Alp online at www.alplifesciences.com, and doctors can write prescriptions and track information on their patients through the Allscripts database, and we can also supply doctors' offices with sample program as well as put it in local independent pharmacies at your request. We hope that this has been an enlightening and educational experience, and we wish you guys the best of health.